Hello and welcome to the third edition in a series around postural management. My name's Richard Harvey and I'm the Clinical Training Manager for Jenks and for Giraffe. So just a quick overview of why we put this web series together. We're really looking to offer some learning for people that are involved in the care of people with complex disabilities. And this is really around the importance of 24-hour postural management. So we've already taken a quick look at an introduction to postural management. We've looked at some of the anatomy and the biomechanics of the body and how that relates to posture. So we are also going to take a look at how we build a stable posture, and that's in seating, lying and standing. Today we're going to take a look into what can happen from adopting poor postures and the secondary complications around that. And we're also going to take a look at some of the fundamentals of assessing for posture. So just a little bit about me. I've got around 8 years experience working in the NHS, and that's in a variety of different settings. I've got quite a lot of experience assessing people's postures as well, especially those with complex disabilities. And that's led to recommending equipment provisions in seating, standing, sleeping, bathroom and mobility. And I've also got a postgraduate certificate in postural management for people with complex disabilities. Today's presentation is on secondary complications. Now, we've taken a look already at an introduction to postural management, so we have an understanding of why we might need to manage someone's posture over a 24-hour period. We've taken a look at how gravity and other forces can impact our posture and what that means to our alignment. We've also taken a look at the body itself and the anatomy of our skeletal system and the different body segments and how they can relate to one another. So today we're really going to take a look at the knock-on effects of adopting a poor posture over a long period of time. Some of the key learning that I hope you get out of today, we're going to take a look at soft tissues, so that's our muscles, our ligaments, our tendons, and we're going to take a look at how they can adapt over time if we are immobile. We're also going to take a look at the formation of contractures and the differences between that tissue adaptation versus a contracture and what that means in postural management. We'll take a look at any damage that can occur to our tissues, so any tears, any fractures, and the relationship our body has with pressure. We'll also have a look at how adopting poor positions and poor postures can lead to an increased risk of infections. And throughout the whole presentation, we're going to keep the idea of pain and discomfort in our minds, just to question whether or not we are managing that as best as we could. Now, when we think of what a secondary complication is in terms of postural management, a secondary complication is really, it's a physical problem or an issue that can occur as a direct result of somebody's disability. So if a person is not able to move or change their position, a lot of things can happen. So there's a lot of negative impact that can happen, whether that's pressure related, if it is an infection, or the formation of contractures. So really it's a physical problem that can occur as a direct result of that person's disability. So let's take a look at some of the problems that are associated with secondary complications. First of all, it can increase the suffering of people with disabilities. And obviously, anybody that's involved in the care of someone with disabilities is looking to reduce that as much as possible. It can have a really negative impact on the quality of someone's life, such as the loss of function and independence for someone. So, for example, if somebody does form contractures at the knees and the hips and they're not able to be in a standing position where previously they have been able to do that, obviously that limits the amount of function that person has. We spoke previously around muscle plasticity and the fact that somebody with neurological problems, they don't always have the ability to regain that damage that occurs. So it can really be irreversible, that damage that does occur, which can lead to more discomfort and more pain, which obviously we look to minimise as much as possible.
And also one of the other things is our bones as well. So osteoporosis is the kind of the breakdown of the bone mineral density within our bones, which can weaken and cause fractures into our bones, which again can lead to pain and discomfort. So if we just remind ourselves of the three main aims of postural management, so function being one, so being as independent as possible, to minimise damage as the second, and to reduce that energy expenditure and fatigue as the third. So if we unfortunately contract quite a few secondary complications, it can really limit our function. It can also increase the amount of damage that occurs to the body, which means that we may have to adopt more asymmetrical positions, which may tire us in holding certain postures. So really the impact of secondary complications can be quite debilitating for people with disabilities. Now if we just take a look as well at this flow chart that's below on the slide, because it's a really good representation of the possibilities that can happen and how it can lead to these secondary complications. So in the top left-hand side here, we've got the words immobility, imbalance and instability. And that leads off to a couple of different things. So on the right-hand side, that big box, we've got a list of kind of secondary complications that can occur. And at the bottom, we've got that idea of an unequal loading. So if we've got if we're loading differently throughout our body in different positions, this can lead to increased pressure, which can then also lead to pressure-related injuries and pressure sores, which can also create more of a bed-bound situation for a person. And on kind of the flip side, a bed-bound position can also increase the likelihood of gaining pressure sores. So it's a bit of a vicious cycle. And then becoming bedbound is obviously going to decrease the quality of our life. It's also going to increase the cost to health providers, so with additional surgeries or additional care costs that may come into play there. So now if we move on to tissue adaptation and contractures, and we're going to take a look at the differences between the two, and why it's so important to know the differences when we are looking to manage someone's posture. So first of all, tissue adaptation. The way that I like to think of it, you have a slide in front of you with basically silly putty that has been over an object, and you can see how it is adapted and we've formed the shape of that object. Our body is much the same as that. So if I stayed in this seated position over a long period of time, all my soft tissues would just mould around the chair if I didn't move, if I didn't adjust my position and distribute the weight through different parts of my body. If we take, for example, someone that's broken a limb, so on the previous slide we had a guy in a cast there. If someone's broken their ankle or maybe snapped their Achilles tendon, we have to fix that limb in a position where it's not going to be able to move. Now over time, we had a look in the previous presentation that there's a lot of things can happen to our tissue, so that atrophy or the breakdown of the muscle where it becomes weaker but also becomes less in mass. The same thing happens with our kind of tendons and muscles and our ligaments. So if we're fixed in a position over a period of time, they can become tighter, and they can also lose the range of motion as well, and not able to get that full kind of joint range of movement that is natural. Now that can happen really, really quickly. So if we think of different situations where that might happen, so in a hospital setting, if somebody's had a kind of a terrible traumatic injury and has ended up being kind of bedbound over a period of time, you'll find that it's really important for people, like the therapists that are in that ward environment, that they'll go around doing a lot of passive stretches to make sure that tissue doesn't form a contracture. So the idea of tissue adaptation is really where the tissues become quite tight, but they're still able to achieve that full range of motion. But those ligaments are becoming firmer. It's not able to move as freely. So some of the issues around that is it's more prevalent in the elderly as well. So that's because generally the older we get, the less mobile we do get. So the risk does increase for that. People that have broken their limbs, obviously, we've discussed that. So the range of motion there is limited for a certain amount of time. Anybody that becomes immobile and is not able to adjust their own position, it's going to lead to more likelihood that tissue adaptation is going to set in. And we've also kind of thought about those people with neurological conditions, again, that if it gets to a certain point that muscle plasticity isn't going to regain itself and move back into that elasticity. Now, the formation of a contracture, what's different between adaptation and contracture? So a contracture is where the joint is now constrained, so it's not able to move throughout the full range of motion that it should be able to. And that's because those soft tissues have adapted and fused to a point where they're not able to reach that full range of motion. So that's really what we're trying to avoid once tissue adaptation is set in. We're trying to avoid those contractures being formed, and that can happen throughout a lot of different ways and a lot of different interventions, such as splinting, passive stretching, adapted equipment as well, so standing frames, things like that. So if we take a look at some of the problems that can occur from forming a contracture and what those issues are. Obviously, first of all, we've got those soft tissues that become fixed again, so we can't get that full range of motion, and that can in itself lead to pain and discomfort. We've spoke about the fact that people with complex and severe neurological conditions, the plasticity of their muscles, if they reach that point of no return, they're not able to regain that plasticity. Also, if we take, for example, somebody that's adopted a lying position where the legs are in a windswept position or falling over to one side, and over time that can in itself create contractures and fix. If we then look to put that person into a seat or in a seated position, it's going to be harder to get that nice wide base of support that we look for in seating. That's not to say that we can't accommodate for those asymmetries, but because we can. But there are a lot of things that we need to consider with that. So the choice of equipment and what's available to that person will be kind of greatly diminished as well. So this will obviously impact on our function. We've spoke before about being in that standing position, how we look for a nice aligned, extended position in all of our kind of lower limbs. If we're in quite a severe knee flexed position, how that's going to impact our standing position. So it's going to be creating more pressure and more weight going through the knees rather than the full body, and going through kind of the hips as we like to in a standing position. And that really will impact the reasons why someone might want to be in a standing position as well, and whether it's actually conducive for that person's health. And again, this can lead to pain and discomfort in all the issues that I've kind of mentioned above. And being in those kind of unbalanced positions as well can create different loading in different parts of the body, which can then increase the issues around pressure, which we'll go on to talk about in a second. So this is just a bit of a flow chart just to really depict for you the difference between tissue adaptation and contractures. So somebody that adopts a certain position for over a prolonged period of time, so a poor position, over time that tissue may adapt and become tighter and start to become it's more difficult to move through that range of motion. After that, a contracture can form, which would then create a fixed position, so that person wouldn't be able to go through that full range of motion, which could then lead to a deformity. Now if we take a look at tissue damage, so there's a few different things that can happen to our tissue. We can develop tears in our tissue, fractures, pressure. We've looked at osteoporosis already, or discussed what that is, which is the breakdown of the minerals within our bone to make them weaker, which can lead to fractures. And also there's things to consider around moisture and friction. So really, if somebody that has areas of the body that are quite wet, so that could be through sweating or maybe personal care and not being being very dry. The process of rubbing that area over a period of time against the surface can create different wounds as well. So we're not really going to focus in too much around moisture and friction, so I just wanted to mention what I meant by that. Now if we take a look at tears and how this can happen in the body and why this may happen, a tear to the skin is really where force is applied to the skin and the force is too great and it causes a break in the skin. So this can happen in a number of different ways. So first of all, this can occur through what we call shear force. So for example, this can happen quite frequently in a seated position. So somebody that's sat on the surface of a chair, and if their body weight is moving forward and the surface area itself is staying where it is, that can cause what's called shear force and can cause a tear in the skin. Another reason that this may occur is through manual handling. So a carer, for example, that's doing personal care on a person with disabilities, through just moving a person, their skin may be quite thin, and which can cause tears through the pressure of a carer's hand. Obviously, people with more complex disabilities or who might be a bit older, our skin starts to become more thin, which means that you're at more of a risk of things like tears. Also, if tissue adaptation has started to set in as well, our soft tissues become weaker, so it's easier for them to tear. And this can obviously lead to things like infection and open sores where bacteria and other pathogens can enter the bloodstream. And again, this can itself lead to a lot of pain and discomfort in somebody with disabilities. So being very mindful of someone's skin is really important. Fractures, this is another issue that can occur, with especially people with complex disabilities. The risk is much higher of incurring fractures, and this is because the amount of time that they are spending in a weight-bearing position is often a lot less. So the way that our bones get stronger is adopting more of an upright, load-bearing position, and through kind of our gait and our walking, we develop stronger bones. People that aren't able to do this obviously aren't able to gain as much strength in their bones, which can obviously lead to fractures in our bones. Also, people with neurological conditions, they may affect their balance and their stability, which will increase their risk of falling as well, and those falls can obviously result in fractures. Also, through that lack of standing, the minerals in our bones our bones become more demineralized, which means that they're more susceptible for fractures, which again is not very comfortable. If you've ever fractured a bone, you'll know that it can be quite painful and cause a lot of discomfort. And then if you think of the amount of time that it may take someone to recover from that damage, it may also lead to a loss in someone's function. So if someone is beginning to look at standing or walking, and they've made progress in that motor skill, if they then suffer a fracture, it's obviously going to set them back in their motor development. And some of this damage can also be irreversible as well, like we've mentioned in previous slides. Now, if we take a moment to talk about pressure, pressure itself and pressure care could be its own presentation, really. There is so much to cover. So really, we're just going to take a brief overview of what pressure is and how it relates to somebody that is very immobile. So throughout our body, we've got different boniest points as well, so sharper bits of our skeleton. And if we're in one position over a period of time and we've got gravity bearing down on us, the weight of our skeleton can start to actually pierce through our soft tissues from the inside. And that's really what a pressure-related injury or a pressure sore is our skeleton basically trying to leave the body. So if we don't manage someone's position and change it quite often, the build-up of pressure can increase, and those issues can kind of occur, and those injuries can occur. Usually the pressure related injuries now, or pressure sores, they're usually graded from 1 to 4, and that's depicted by how much of the soft tissues have been affected by that pressure, how far the skeleton has managed to kind of break through the different layers of our skin, as you can see in this slide here. I decided not to put up any kind of images of pressure-related injuries, as they are quite graphic, and I think we'll probably do another presentation around pressure where, if you are interested in that, we can look in that a little bit further. So now if we take a look into infections, so our body systems, we have many different body systems, our circulatory system, our respiratory system, our digestive system. Each one of them can develop infections, and they can be directly impacted by our posture. Now if we take a look at the respiratory system, so our breathing, and how our posture can affect that. So if we think of being in a bit more of a slouched position, and our chest cavity is not as wide, so the lungs aren't able to function as well, we're at more of a risk of developing infections. And that's because somebody that's immobile or with severe or complex disabilities, if they're adopting that position over time, there might be a build-up of what's called secretions or fluid on the lungs. Now, if me or you had that fluid and we wanted to get rid of it, we'd have a natural kind of cough reflex to be able to do that, to clear our lungs. However, a lot of people with complex disabilities aren't able to do that and require quite a lot of suctioning sometimes. Now, if you're not able to clear those secretions, it can lead to also a build-up of bacteria, which can then lead to an infection, which in itself can create more discomfort and more pain, but also it's the knock-on effect of being able to recover from that infection, and how that impacts someone's function, their independence, and what kind of the long-lasting damage might be from gaining that infection to being able to be fully recovered. There's also risks of aspiration as well, so if somebody is taking in fluid, but it kind of accidentally goes down the windpipe, the risk of infection of those fluids being kind of trapped in the lungs there also increases. Now, it's known that being in a position where the shoulders are nice and kind of retracted back, and that the chest is nice and opened up, they kind of yield better kind of results in reducing infections, but not everybody is able to get into those positions. So managing someone's posture with respiratory issues is quite difficult, and those are the things that we need to really consider. So the urinary tract as well, in our kind of our bowel system, is something to think of. So generally people that are not mobile and not active, they tend to have weaker bodily systems anyway. So somebody with a weaker bladder isn't able to expel urine in as efficiently as somebody that has got quite a normally functioning bladder. So that build-up again of urine and the bacteria that's in our bodily waste can build up over time and lead to infections. Also, it's a positional thing as well. So if we think of how our bowels work as well, and being in an upright position, gravity can help to take effect in expelling those bodily fluids and waste materials as well. So if we're not in conducive positions to do that, again, those waste materials can build up in the body and lead to infections. Also, people with quite complex disabilities, they're more likely to be frequently catheterized, and having kind of a foreign object inserted into the urinary tract can lead to also infections itself. Also, certain conditions that affect our muscles, and especially the sphincter muscles that allow urine to pass through the body, can be effective, and that again leads to a build-up of waste materials, which can lead to infections. And all of this also can only cause more discomfort and pain as well. So by not managing someone's posture and allowing that that waste material to flow through the body can also lead to more discomfort. then also the recovery time as well when we think of any infection, and how that can lead to the increased likelihood of someone becoming less mobile, is something to consider here. So again, if we take that example of somebody that's being able to get up into a standing position or a walking position, then having to wait until you are fully recovered and have the strength to do that may set you back on your motor skills goals as well. One other thing to kind of consider as well in terms of any infection would be the ability to communicate the pain and discomfort. So a lot of people with complex disabilities aren't able to verbally communicate their pain and discomfort. So it's something to bear in mind throughout kind of any of the secondary complications, really, is how that person can inform you or communicate their pain and discomfort. Now, if we just take a look at everything we've learned today, just to summarise, so we've taken a look into what secondary complications are and how adopting a poor posture over time can lead to those secondary complications, and therefore a robust postural management regime is needed to really negate those secondary complications from happening. We've taken a look at tissue adaptation, so the stiffening of tissues, opposed to a contracture, which is a fixed formed constraint of a joint. And so the implications of that within a 24-hour postural management plan would be that if the tissue adaptation has started, then what we need to do is very different to if the contracture has already formed. So if someone's tissue has started to adapt, but we've got that full range of motion, then it's really important that we look to maintain that full range of motion. Now, we can't do that with contracture, so what we're looking to do there is actually stop anything from getting worse. So we need to manage that, so we need to accommodate for any contractures, but we need to correct any tissue adaptation. And we also need to consider pain and discomfort when we do that as well. So we've looked at also pressure-related injuries and how they can form. We'll probably look a little bit further into that in another presentation. We've looked into tears and how they can happen, and fractures and the implications of what can happen after those injuries have happened. And we've also talked about the recovery time being a bit longer usually for somebody with disabilities than kind of a normal healthy person. We've also taken a look at the different infections that can occur from adopting a prolonged poor posture, and how that has a knock-on effect to our general health as well. So the next presentation that we're going to take a look at, now that we've had a look at what can kind of go wrong and what we want to avoid, we're going to look at how we can build stable postures. So we're going to take a look at seating, we're going to take a look at standing, and we're going to take a look at lying. And we're going to take into consideration the different things we need to consider when we build stable postures for each of them. So again, thank you very much for listening. I really appreciate you lasting this long in my presentation, and I hope that I have not bored you to tears and that you're getting something from these presentations. So I look forward to doing the next one.